Hi students, this is the MCQ key for the questions we have posted for the target NEET PG students. So we'll discuss the answers. This is the answer key and we'll discuss contents of the mid-palmar space are all except. Okay, so the answers are FDP of fourth finger. FDP means flexor digitorum profundus. So these are all the long tendons which are going to the all four digits. Okay, and then it is given as second lumbrical and first lumbrical also. So the answer we have chosen is first lumbrical. Why? Because the thenar space and the mid-palmar space, the thenar space is present laterally and mid-palmar space is just lying on the second, third, fourth, fifth metacarpal bones. Okay, and the tendons are flexor digitorum profundus. You will be having four tendons. From there only the lumbricals it takes its origin. So there are four lumbricals. They take its origin from there. So obviously the first lumbrical it's the content of the thenar. Rest three lumbricals are the contents of the mid-palmar space. So answer now it is very easy. The first lumbrical will not be there in the mid-palmar space. Posterior cord of brachial plexus supplies. So posterior cord nerves the student should know. Upper subscapular, lower subscapular and thoracodorsal, radial, axillary. Okay, these are the nerves of the posterior cord of brachial plexus. So upper subscapular supplies the upper part of subscapularis, lower subscapular supplies the lower part of the subscapularis and teres major, and thoracodorsal nerve supplies that is also called as nerve to latissimus dorsi. So it supplies latissimus dorsi, and radial nerve it supplies the posterior compartment of arm as well as the forearm. And then axillary nerve it has two divisions, one anterior division, one posterior division. You can see here I have mentioned number 11 as the axillary nerve. This is a space called quadrangular space. I hope you remember that this 10th is teres minor and the teres major I have written boldly, and then long head of biceps also I have written. So this side H is humerus, so that is the surgical neck of the humerus on the top near the axillary nerve. So that area is called quadrangular space. So the quadrangular space you are having the axillary nerve, it has two divisions, anterior division and a posterior division. Anterior division supplies the anterior and middle fibers of the deltoid, and it gives one cutaneous branch called upper lateral cutaneous nerve of arm. Okay, and the posterior division which goes back, see look at this, just above the teres minor near the 10, that area is deltoid muscle. Okay, so posterior fibers of posterior division supplies the posterior division of fibers of deltoid as well as the teres minor. So the answer is axillary nerve, it only arises from this. Rest all the pectoralis minor is supplied by the medial pectoral nerve. Coracobrachialis is supplied by the musculocutaneous nerve, which is coming from the musculocutaneous is a branch which comes from the lateral cord of brachial plexus, and biceps is also a branch from the musculocutaneous. It takes nerve supply from the musculocutaneous. It is also a branch of the lateral cord of brachial plexus. We'll move on to the next question. C5, C6 nerve roots. So this is a bit complicated question. C5, C6 only nerve roots. So the C5, C6 only from the musculocutaneous nerve. Okay, so biceps brachialis. Why we have chosen the coracobrachialis? Coracobrachialis it also gets a root C7 along with C5 and C6. So we eliminated that. Okay, brachioradialis, deltoid, supraspinatus, infraspinatus, all of them they take C5, C6 root. That's why in Erb's palsy all these muscles are paralyzed. That's why the patient's arm in Erb's palsy is medially rotated, extended, pronated, all those things. So this is a pakka question of Erb's palsy. So coracobrachialis, keep it in mind, it takes another one root C7 also. That's why it has been chosen as a correct answer. And then here we have written that a 30-year-old carpenter suffers from a crush injury, little finger. So little finger, the student should know one thing. Digitorum profundus means it all four digits, so it goes to all four digits. Digitorum, extensor digitorum means extensor or aspect of all four digits, and palmar interosseous, dorsal interosseous, either this or this. So the student should have a sound knowledge about the attachment of interosseous. We'll see. Look at this here. if you see all four interossei are there, this is called as dorsal interossei. We don't want the dorsal interossei for the little finger, since the action of the dorsal interossei is dab, D for dorsal interossei, A, B for abduction. So this is not needed. So for the little finger, no abduction is needed. Already it was separate only. So the fourth finger, little finger, doesn't have any separate dorsal interossei muscle. The same way, palmar interossei, if you see, middle palmar interossei action is adduction. Palmar interossei is adduction. So the middle finger acts as an axis, so it doesn't have any attachment. For palmar interossei, it doesn't have any attachment here. Like the same, the thumb also it doesn't have any attachment because you have separate adductor pollicis for thumb. So these three are very important for the NEET preparing students. The following cutaneous nerve is given by the radial nerve in spiral groove. Radial nerve in spiral groove, in axilla, actually two components is needed. One is radial nerve in the axilla supplies two muscles, long head of triceps and medial head of triceps, and one nerve, posterior cutaneous nerve of arm. Okay, keep it in mind, these three. And then when it comes to the spiral groove, okay, when it comes to the spiral groove, already I have showed you the spiral groove. This is a spiral groove. When it reaches the spiral groove, here it supplies lateral head, medial head, and anconeus, three muscles and two cutaneous nerves. One is lower lateral cutaneous nerve of arm, and another one is posterior cutaneous nerve of forearm. Okay, these two. So totally five. Two cutaneous and three muscular branches are given in the radial nerve in the spiral groove. So the student should know this, unless otherwise he cannot answer this question. And then ruling out upper lateral cutaneous nerve, already I told you, the nerve which supplies the deltoid only, it gives a branch, so that is axillary. And then lateral cutaneous nerve of forearm is a continuation of musculocutaneous nerve after piercing the coracobrachialis. The last is posterior cutaneous nerve of arm is a branch given in the radial nerve in axilla. So that's all. And next question, a patient is trying to make a fist. Okay, he could not flex the index and middle finger, which nerve is damaged? So the question is very simple. This is a very important sign. Most of you know that this is called Benedict sign. So here the student should know which one flexes the metacarpophalangeal joint. So if you know the answer, it will be very easy to land. Okay. Now, so metacarpophalangeal joint is flexed by metacarpophalangeal joint is flexed by the lumbricals. The action of lumbricals is flexion of the metacarpophalangeal joint and extension of the interphalangeal joint. So this is very important. So all the four lumbricals already we know. Medial two lumbricals are supplied by the deep branch of ulnar nerve, and lateral two lumbricals are supplied by the medial nerve. Okay, so this is how, see, this medial two are bipinnate and the lateral two are unipinnate. So this is very important MCQ. The next one is a patient has difficulty in extending his four components are there, so you should concentrate more. Okay, one component number one is the patient is not able to extend his finger. Component number two is he can make grip and hold a pen. It means flexors are working properly. Wrist extension, wrist extension is possible. So he is able to do the wrist extension because the extensors of the wrist are extensor carpi radialis longus and brevis, and there is no sensory loss. There is no sensory loss. So four components are there. So component number one, only he is not able to extend his fingers. It means only the extensors of the fingers are affected. So the radial nerve root is very important. So radial nerve starts, already we have discussed about radial nerve in spiral groove. After that, what happens when the radial nerve reaches above the lateral epicondyle, it gives a branch to brachioradialis and extensor carpi radialis longus and brevis. After that, it divides into, at the tip of the lateral epicondyle, it divides into two. Okay, tip only, here it divides into two, superficial branch and a deep branch. The superficial branch straight away along the radial border, it goes over the anatomical stuff box and divides into dorsal branches, digital branches. But the deep branch, it passes between the two heads of supinator. It enters inside and continues as posterior interosseous nerve. So posterior interosseous nerve only supplies all the extensor digitorum, digite minimi, all these structures. So our answer is posterior interosseous nerve. It cannot be C8 and T1 because C8 and T1 forms the lower trunk, so ulnar nerve, so ruled out. Anterior interosseous is a branch of median nerve, ruled out because the patient nicely holds the pen, so flexors are working properly. And radial nerve at the lateral epicondyle, both the branches will be cut if there is a damage, superficial and deep. But here it is given as no sensory loss. So superficial is intact. So only the deep branch is out. So this is how we have come to the conclusion. And then next is 12-year-old boy. Look at the x-ray. If you see the x-ray, nicely surgical neck of humerus is fractured. So this nerve which winds around the surgical neck is your axillary nerve. So axillary nerve, already told you the supply of the axillary nerve. So with that we have to come to the conclusion. Delta and teres minor. Okay, already we have discussed anterior division, posterior division. We have discussed. Just go through that. And then Canaval sign, just read about this. This because of the tenosynovitis. Tenosynovitis, you will not be able to flex the particular finger, and if you try to flex it, it will be very painful and the finger will be swollen because of the inflammation. And flexion deformity, because this question was asked because it was asked in previous NEET papers, that's why I selected that question. And flexion deformity of the distal interphalangeal joint, which means mallet finger. They are talking about the mallet finger. So we all should read about extensor expansion properly. The extensor expansion is the extensor tendon expanded over the proximal phalanx, and it has a central slip and two collateral slips. The central slip is attached to the, look at this, the central slip is attached to the middle phalanx and the two collateral slips are attached to the terminal phalanx. So if the terminal phalanx collateral slips are damaged, what will happen? The terminal phalanxes, the patient is not able to extend the terminal phalanx, but the flexors will be overacting, so they will be having mallet finger. If the same thing happened, if the central slip is injured, what will happen? The patient will not be able to extend the middle phalanx, but terminal phalanx he can extend. So that is buttoneer deformity. So these two are very important. So extensor expansion is formed by the extensor digitorum tendon. All the four tendons it forms, and the interosseous and lumbrical muscles are getting its insertion in the extensor expansion only. So keep it in mind. So that's all about the extensor expansion, central slip and two collateral slip. Most of the question papers you can see this question. So that's all about the explanation. If you have any questions, please do ask in the comment section. Thank you.